Hello, dears, and welcome to Al-Hussaini Virtual Lab Pathology Talks, Tips, and Practical Tips. What I'm going to be sharing with you today is a very interesting and a rare type of a tumor with a new nomenclature as per the new WHO classification of tumor of the central nervous system and endocrine system, a tumor. This is Cauda Equina neuroendocrine tumor, formerly known as Cauda Equina Paraganglioma. What is really interesting about this case is that in addition to the neuroendocrine component, there was a gangliocytic component that is described in around 20% of cases. So this is a case of a 37-year-old male patient who presented with low back pain and was found to have an L3 spinal cord lesion. And as you can see, the tumor here on the low power magnification has this component with large cells and this component here with the smaller cells, and we're going to zoom in. So this is the component with the smaller cells where we can see the tumor cells arranged in nests or Zellballen. These are tumor cells composed of cells with acidophilic cytoplasm, granular cytoplasm, with the nuclei vesicular showing small inconspicuous nucleoli. And these tumor cells are arranged in nests separated by fine fibrovascular pores. There is little in the way of pleomorphism. Now, moving into the other area of the tumor, there is an area of a transition where we can see loss of the formation of the nest that was seen in the first area and increased amount of fibrosis, in particular sclerosis, and then more and more towards the other area of the tumor, where we see again here sheeting of the tumor cells, complete loss of the very characteristic nesting pattern, and then scattered mitotic activity. And now this is the second component where we can see large cells. These are ganglion cells, dysplastic ganglion cells having abundant acidophilic cytoplasm, vesicular nucleus with a prominent nucleolus, really aggregating haphazardly, separated by again some sclerotic fibrosis. So this tumor, as if we have two collagen tumors, one that is a neuroendocrine tumor and the other is very reminiscent of the ganglioneuroma that sometimes we encounter, for example, in the posterior mediastinum or sometimes even in the paraspinal area. So these are the two components. This is where we have the typical appearance of a neuroendocrine tumor, and this is the typical appearance of the ganglioneuroma like a tumor. Put together, this is really what distinguishes this very rare type of a tumor, which is the Cauda Equina, a neuroendocrine tumor showing gangliocytic differentiation. Now into the immunostains, both components are positive, strongly so, for synaptophysin as well as a chromogranin in the neuroendocrine component, as well as in the component showing the ganglioneuronal or gangliocytic differentiation. Now, importantly, S100 tend to be positive in some sustentacular cells that are seen around the nest in some of the paraganglioma, but remember, this tumor is no longer considered a paraganglioma. Now, the gangliocytic component shows positivity, nuclear and cytoplasmic. Remember, S100 usually is in nuclear and cytoplasmic staining in some of the ganglion cells, but more importantly, in some spindle cells in the background, and these are the Schwannian cells or the cells showing the Schwannian differentiation. So these cells in the background really are the Schwannian cells or the Schwannian cell component in the ganglioneuroma like a tumor. Now, cytokeratin is characteristically positive in the neuroendocrine component, and this is one of the reasons why this tumor is no longer called paraganglioma, because paragangliomas are typically negative for cytokeratin, while it has always been known that Cauda Equina paraganglioma is cytokeratin positive. This is so because these tumors are in fact neuroendocrine tumors, while the ganglionocytic component is completely negative for cytokeratin. cytokeratin. Now, also, we know now that paragangliomas are typically positive for GATA3, and this particular paraganglioma in the Cauda equina is typically negative. So this is a second reason why this tumor is no longer called paraganglioma. So this is typically negative. Ki-67, some increased positivity in the neuroendocrine component, around 3 to 4%, much less so in the gangliocytic component. And reticulin showing here a tendency, not really very nice framework for the reticulin fiber or nesting growth pattern, while the areas of sclerosis tend to show more of the reticulin fiber deposition. So in conclusion, this case is previously used to be known as Cauda equina paraganglioma. Now the new terminology adopted by the WHO is Cauda equina neuroendocrine tumor, and this is considered to be grade 1 per the WHO classification. Now remember, because of the presence of the gangliocytic component, this is usually added actually to the name. So this is the gangliocytic Cauda equina neuroendocrine tumor. This is no longer known as paraganglioma because of the positivity for cytokeratin, which is typical in this case, and the negativity for GATA3, which is typical of cases of paraganglioma. I hope you find this tip useful in your daily practice. Thank you.